Thank you, Ms. Delani. Start with a round of questions now. Dr. Knight, can you give some assessment of the U.S. Programs in our aid, our $5.4 billion, most of which was used initially, some left over, but how could we have better utilized the private sector in Liberia? In what ways did we fully leverage the resources that were there, and what could we have done better to utilize those resources?
I think it boils down to a very simple sort of attitude, which is historically, and we saw it in the beginning of the Ebola outbreak, that the private sector was often sort of seen as just remote, just give us a check and let us get on with it. And they underestimated just how much physical resource we had in the way of assets, expertise, way around the country. And sometimes the really basic stuff, which sometimes gets in the way, like just somewhere to sleep that night, access to a Land Rover, access to a bulldozer, and somebody to drive it. And so it sort of goes to that sort of almost closing remark I made in my more formal entry about just dialogue and collaboration. And so treat the private sector as an operational tactical partner and start the dialogue with them as quickly as possible. I mean, we were lucky with EPSMG because we had the idea and people came to it. What if we hadn't had the idea? Yeah. Who else could have that idea and just make it a prerequisite when you go into these types of operational places, fields? Who are the big private sector? Who's having a conversation with their big boss in their big corporate office, and who's going to have a conversation with them in country? And I think you'll be shocked if you take the conversation away from the check to how can you physically help us with assets, skills, and expertise. People want to help. So very simple answer, treat them as an operational partner.
Right. I've seen the pictures that you have, the roads around Liberia. Can you give some outline of how much of the country is inaccessible during much of the year? Just you have operations in various parts of the country. How difficult is it in terms of infrastructure that would relate to health care centers as well as businesses?
Well, I'll give you an example which I'm familiar with. You know, to go from Monrovia to our mine, when everything's right, you know, the sun is shining and the road is dry, it can take 3 hours. When we get to these conditions, it can take 10, 12 hours. So imagine trying to run a business, just getting assets, let alone people, to and from that site. We used to have a helicopter, but we've now grounded that as part of our cost-cutting messages. So imagine if somebody gets hurt. Imagine if we break a leg and we need to get somebody to Monrovia. We've got to move them on those types of roads. You know, who would want to work in that environment? You know, and we're sort of saying things such as we want to create confidence and incentives for people to invest in these countries. You know, these really basic things get in the way. So a muddy, destroyed road really makes businesses suffer. You asked me what percentage. I don't actually know the number, but it's a lot, and it's making a noticeable difference.
All right, thank you. In Arizona, we dream of muddy roads like that. But Dr. Punjabi, it was touch and go for a while during the height of the outbreak when there was a case here in the U.S., someone who had traveled from West Africa, and there was a real push for a travel ban that would have affected those countries and cut off airline service. Fortunately, we avoided that. What would that have done, in your view? How would that have affected your operations and others?
Thank you, Mr. Chairman. You know, I was in Liberia at the moment that Traveler was here, and you know, to be very honest with you, it would have felt like an infected wound was being cut off. But besides the moral dilemma there and leaving people behind, it wouldn't have been very strategic. The most important thing that the U.S. did was to keep those doors open, to allow health workers to go there and help stop the infection at its source. So from a strategic perspective, it was wise to keep the doors of this country open.
All right. Thank you. As far as lessons learned, I think that's one that we have to learn again and again, not to overreact on some of these epidemics that make the matters worse. And frankly, that would have been a big blunder on our part, I think, had we pushed through and allowed that to happen. Give us an idea with these local health centers. President Sirleaf has talked about in the next, before she leaves office, to have, I think, 2,000 or so in rural areas. Is that achievable, and how can we help, and are we helping in that effort?
Well, what President Sirleaf, amongst her priorities in the health system, in addition to labs and clinics and hospitals that need to be refurbished and equipped, she has focused in on the health workers. The number you mentioned is around the community health workers. In one effort, she has seen that you can extend health care to the most remote communities. There's about 1.2 million people of 4 in the country, 4.5, that don't have any physical access to health care. So this will bring health care to those regions. Those are exactly the places where Ebola is likely to reemerge. And it also is going to create jobs. We know that rural unemployed people, men and women, is a big issue for the country. It always has been from all perspectives, economically and security-wise. This is a chance to give employment, 4,000 jobs out there. She has asked for 2,000 of these workers to be deployed for the sake of healthcare and jobs by the time she transitions office at the end of the next calendar year. The U.S. is already stepping up to mobilize this kind of support, and a number of agencies I mentioned in my testimony have been designing this program along with the Liberian government. It will be government-led. Private groups will also be involved in helping roll it out. Speed is of the essence, I think, to help stop the next Ebola, but also to make sure we take advantage of the fact that here is a phenomenal leadership from the country itself that's being asked to push forward. So I think what can be done from the Congress's perspective in the U.S. is to make sure that that momentum is preserved, the funding is preserved for that kind of initiative that's so important as a priority to her, and that it's amplified and there are commitments made to the long term. I mean, this is something that isn't going to be built back in a year or even in the next 18 months. It will give us a big head start, but it took years to start to rebuild the health system after our war, and it's going to take years to put this in place, but it will have a high return on investment.
Right. Before I turn it to Senator Markey, let me just say, dealing with Liberia with an epidemic like this, I can't imagine having done that with maybe the prior administration or others that didn't work directly with us. And also on the back end, to have the president of Liberia come back and thank us and thank the American people for the resources and the taxpayer monies that were spent is something that perhaps is not heard often enough by the taxpayers out there who fund these kind of efforts. But there was genuine gratitude and a willingness to work with us to make sure that we can prevent this kind of outbreak in the future. So with that, turn it over to Senator Markey.